Hello there. In today's MHA Brief Explainer, we're going to talk about the assessment and treatment of eating disorders. Eating disorders are a group of mental health conditions characterized by a persistent disturbance in an individual's eating behavior and attitudes towards food. These disorders often have serious physical and psychological consequences and can have a significant impact on an individual's quality of life. There are several types of eating disorders, including anorexia nervosa. This is a serious and potentially life-threatening disorder characterized by an intense fear of gaining weight, a distorted body image, and a persistent restriction of caloric intake. Individuals with anorexia nervosa often weigh themselves repeatedly and are extremely afraid of gaining weight. Bulimia nervosa. This disorder is characterized by recurrent episodes of binge eating, during which the individual consumes large amounts of food in a short period of time, followed by purging behaviors such as self-induced vomiting, laxative abuse, or excessive exercise. Binge eating disorder. This disorder is characterized by recurrent episodes of binge eating, during which the individual consumes large amounts of food in a short period of time, accompanied by a feeling of lack of control over eating behavior. Unlike bulimia nervosa, individuals with binge eating disorder do not engage in purging behaviors. Other specified feeding or eating disorders. This category includes conditions that do not meet the full criteria for anorexia nervosa, bulimia nervosa, or binge eating disorder, but still result in significant distress and impairment. The latest edition of the Diagnostic and Statistical Manual of Mental Disorders, DSM-5-TR, defines eating disorders as a group of conditions characterized by persistent disturbances in eating behavior and related thoughts, feelings, and behaviors. According to the DSM, the following are the specific diagnostic criteria for eating disorders. Anorexia nervosa. The DSM defines anorexia nervosa as a restriction of energy intake relative to needs leading to a significantly low body weight, intense fear of gaining weight, or persistent behavior that interferes with weight gain, and an unduly influenced self-evaluation based on body weight or shape. Bulimia nervosa. The DSM defines bulimia nervosa as recurrent episodes of binge eating characterized by eating, in a discrete period of time, for example, within any 2-hour period, an amount of food that is definitely larger than most people would eat during a similar period of time and under similar circumstances, and a feeling of a lack of control over eating during the episode. Additionally, the individual must engage in compensatory behaviors, such as fasting, purging, for example, self-induced vomiting, abuse of laxatives, diuretics, or enemas, or excessive exercise, to prevent weight gain. Binge eating disorder. The DSM defines binge eating disorder as recurrent episodes of binge eating characterized by eating, in a discrete period of time, for example, within any 2-hour period, an amount of food that is definitely larger than most people would eat during a similar period of time and under similar circumstances, and a feeling of a lack of control over eating during the episode. Unlike bulimia nervosa, the individual does not engage in compensatory behaviors to prevent weight gain. Other specified feeding or eating disorders. This category includes conditions that meet some but not all of the criteria for anorexia nervosa, bulimia nervosa, or binge eating disorder, and result in significant distress and impairment. Examples of other specified feeding or eating disorders include atypical anorexia nervosa, in which the individual has maintained a normal weight, and purging disorder, in which the individual engages in purging behaviors without binge eating. It is important to note that the DSM-5-TR criteria provide a diagnostic framework for eating disorders and should not be used as the sole basis for making a diagnosis. A comprehensive evaluation, including a thorough medical and psychiatric history and physical examination, is necessary to make an accurate diagnosis. The symptoms of eating disorders vary depending on the specific disorder, but they often include disturbances in eating behavior, body image, and self-esteem. Some common symptoms include: for anorexia nervosa, restriction of caloric intake leading to significant weight loss, intense fear of gaining weight or becoming fat, distorted body image, persistent denial of the seriousness of low body weight, menstrual irregularities or the cessation of menstrual periods in females, and fainting, fatigue, and weakness. For bulimia nervosa, recurrent episodes of binge eating, during which the individual consumes large amounts of food in a short period of time, purging behaviors such as self-induced vomiting, abuse of laxatives, diuretics, or enemas, compulsive exercising, binge eating followed by feelings of guilt and shame and electrolyte imbalances and dehydration. For binge eating disorder, recurrent episodes of binge eating, during which the individual consumes large amounts of food in a short period of time and experiences a feeling of a lack of control over eating, eating alone because of embarrassment about the amount of food being consumed, feelings of guilt, shame, and distress after binge eating episodes and weight fluctuations. For other specified feeding or eating disorders, behaviors and attitudes related to eating that cause significant distress and impairment, but do not meet the 4 criteria for anorexia nervosa, bulimia nervosa, or binge eating disorder. Those experiencing any of the symptoms of an eating disorder should seek professional help. Eating disorders can have serious physical and psychological consequences, and early intervention is crucial for a successful recovery. Eating disorders are diagnosed through a comprehensive evaluation that includes medical history. The mental health professional will ask questions about the individual's eating habits, weight history, physical symptoms, and medical history. Psychological evaluation. The mental health professional will ask about the individual's thoughts, feelings, and behaviors related to food, eating, and weight. They may also perform a mental health screening to rule out any co-occurring mental health conditions. Physical examination. A physical examination and laboratory tests will be performed to assess the individual's overall health and determine the presence of any medical complications related to the eating disorder. Diagnostic criteria. The mental health professional will use the criteria specified in the DSM-5 to diagnose the eating disorder. Note that the diagnosis of an eating disorder is complex and should only be made by a qualified mental health professional with expertise in the assessment and treatment of eating disorders. The mental health professional will also consider any additional information that may be relevant to the individual's case, such as cultural, social, and family factors. The treatment of eating disorders typically involves a combination of medical and psychological approaches, tailored to meet the individual's specific needs. Some common treatments for eating disorders include psychotherapy, cognitive behavioral therapy, interpersonal therapy, and family-based therapy are among the most effective forms of psychotherapy for eating disorders. These therapies focus on changing the individual's thoughts, behaviors, and attitudes related to food, eating, and weight. Medical care. Medical care is an important component of treatment for eating disorders, particularly for individuals with anorexia nervosa who may require close monitoring and management of medical complications. A healthcare provider will monitor the individual's physical health and provide appropriate medical interventions as needed. Nutritional counseling. A registered dietitian can work with the individual to develop a balanced and nutritious meal plan and help them learn to eat in a healthy and normal way. Medications. Certain medications, such as antidepressants and antipsychotics, may be prescribed to help manage the individual's symptoms and improve their overall mental health. Hospitalization. In severe cases of anorexia nervosa, hospitalization may be necessary to stabilize the individual's medical condition and provide a structured and safe environment for treatment. Support groups. Support groups can provide a supportive and understanding community for individuals with eating disorders and their families. They can also be an effective supplement to individual therapy. It should be kept in mind that the treatment of eating disorders is a long-term process and requires a collaborative and comprehensive approach that involves the individual, their family, and a team of healthcare professionals. The treatment plan should be adjusted as needed to meet the individual's changing needs and ensure their continued progress and recovery. We're getting close to the end, so let's look at some key takeaways for this video. Eating disorders are a group of mental health conditions characterized by persistent disturbances in an individual's eating behavior and attitudes towards food. There are several types of eating disorders, including anorexia nervosa, bulimia nervosa, binge eating disorder, and other specified feeding or eating disorders. Eating disorders are diagnosed through a comprehensive evaluation that includes a medical history, psychological evaluation, physical examination, and diagnostic criteria. Treatment of eating disorders typically involves a combination of medical and psychological approaches, such as psychotherapy, medical care, nutritional counseling, medications, and support groups. Treatment of eating disorders is a long-term process that requires a collaborative and comprehensive approach. I hope you have enjoyed your learning. For more on eating disorders, nutrition in counseling, and a wide range of mental health topics, visit the Mental Health Academy blog on www.mentalhealthacademy.com.au/blog. Thank you for watching.